Remember to subscribe to our YouTube channel at NDN TV Nigeria. Click on the subscribe button and be the first to get notifications.
Residents of some rural communities in Rivers, Delta, and Abia states are facing a dire healthcare crisis with high rates of infectious diseases and other pressing medical issues. This distressing situation stems from either a complete lack of healthcare facilities or the presence of inadequately equipped ones in and around their communities. In the light of these severe challenges, these residents are urgently appealing to government officials and agencies at all levels for immediate intervention and support to address their critical needs and alleviate the ongoing health crisis.
The United Nations Sustainable Development Goal 3, which is to ensure health and well-being for all by 2030, was designed to prevent needless suffering from diseases and premature death across the globe. However, in Nigeria, just like other developing nations, the implementation of this goal has been very slow, particularly in rural and vulnerable communities of the Niger Delta region. It is particularly concerning that the oil-rich region, for decades on ending, continues to struggle under the shackles of high rates of infectious diseases, poor maternal and child health indicators, and limited access to healthcare facilities. In most of its rural areas, there is a complete absence of hospital facilities, and where they exist, they are rather inadequately equipped to render even basic services such as proper examination of pregnant women. Recently, Inside the Niger Delta visited Elele Alimini in Emoha local government area of Rivers State, where the story mirrors the grim reality of the health sector in the Niger Delta. The residents, who are left with a rubble of what used to be a general hospital, but now stands as a den of reptiles and rodents, narrate their ordeal.
This Alimini is a big Alimini, and we're supposed to get hospital, because hospital is the most important for health. And now we don't have hospital here. And the people are dying. Before you took somebody here to Port Harcourt, that person has given up. But assuming that we have hospital here, when somebody is sick, you run to that place, they will settle you and it save the life of that human being.
Like one woman died the other day before rushing her from here to UPTH. Couldn't survive it. But we have a big hospital like that. That hospital was called County Western Hospital. When we had Degema province, Ahoda province.
This is the only hospital, not even in this community, around this area. So you see this community, there is no other hospital, no health care. So you can imagine when we don't have such, what will be the result?
The situation is not different in the riverine community of Upokiti in Warri South local government area of Delta State.
We have been suffering in this place because we are in the river area. We have health center, no nurse, no doctor.
We will get belly for you, go the cross when one born, and that one has stress to we need the hospital.
Arochukwu in Abia State is another stark example of the healthcare crisis in the region. When our crew visited the general hospital, it was deserted with no sign of human activity, and the compound was completely overgrown by grasses. Attempt to speak with a nurse and a matron in a secluded section of the hospital were not successful, as they declined to comment on the state of the affairs at the hospital. In recent times, the Niger Delta Development Commission (NDDC) has championed interventions such as its free medical outreaches to provide succor to these underserved populations. While this has proven helpful, the people are calling for lasting and enduring solutions to their medical needs.
We need a standard hospital from government, that good doctors, professions will be there so that they could help and save the life of our people here.
If this place is fixed, Elele Alimini is not going to die as they are dying now. Yes. Because any sickness at all always kill them, based on there is not anything like hospital.
Policy expert and educationist Dr. Godwin Edozie, while corroborating this troubling condition, stressed the urgency of addressing this systemic issue plaguing the healthcare sector in the region.
We are saying let there be mobile hospitals. Let some communities be integrated together so doctors can visit them on designated days. And when there's an emergency, somewhere around that community, they have a place where the ambulance is, on water if need be. That ambulance takes off immediately to a tertiary hospital or a bigger hospital, not so far, so they can get attention.
In tackling this and other medical issues, the NDDC is also entering into a partnership with the World Health Organization (WHO) to accelerate healthcare delivery for the poor and vulnerable in the region. This initiative is expected to enroll 1 million Niger Delta citizens in health insurance and strengthen the capacity of health facilities and workers in the region for health security. The scale of the challenge, however, requires more robust efforts by all stakeholders, including state government, to improve the health and well-being of all in the oil-rich region.
Inside the Niger Delta,